So today we're going to talk about headaches, reasons why you would have headaches. They're going to come from external factors and internal factors. So let's talk about internal factors for a second, because those are the ones that usually require a specific injury or something. So something that's causing an internal headache for an internal reason is really coming from like a concussion or a direct blow to your head. You hit your head on something, and what happens is your brain, which is inside your skull, so this would be your brain, it's soft and cushy. That soft tissue, just like if you twisted your ankle, that soft tissue begins to swell and it actually gets larger in that spot. And so as the brain swells, your skull is on the outside, there's a little bit of space in between it. And so the brain swells and it actually starts putting pressure onto the skull. That's what would cause an internal headache. That is a very severe concern that needs medical attention right away. So if there's been any direct impact, concussion related symptoms, etc., you've got to have a medical professional check that out. If you have a concussion or a suspected concussion, that's something that we can help you with and we can assess, because if you don't get that pressure off of the brain, you can actually end up with some very severe long-term damage. But let's talk more about what would be called an external headache. So when we're talking about external headache, it means that it's coming from external factors. So if we're looking at yourself from behind, this is the back of your head or the base of your skull, and then these are the vertebrae or the bones in your neck, and your shoulder blades would be down here. There are muscles that run from your shoulder blades up to the base of your skull, and those muscles all attach to there. So every other headache that you get, with the exception of, again, a direct blow to your head or a concussion-like headache or some swelling in your brain that's coming from a tumor or something like that, is coming from an external factor. It's coming from those muscles in your neck. And so what starts to happen is that those muscles that come and attach to the base of your skull, they start to pull. Well, again, your skull, the surrounding, the bone on the outside, there's separate bones that surround. When that pressure is pulling down on those muscles, those bones in your skull begin to close in and actually put pressure in on your brain. And again, it's that pressure that causes the headache. So your brain hasn't changed in terms of shape or size. It hasn't swollen like it would with an internal headache. But that external pressure, the muscles on the top of your skull, on the side of your skull or the top of your skull, because they're being pulled on by the muscles on the back of your skull, they begin to put pressure inward on your skull, and that's what really causes that headache. Well, how do you take care of all this? Well, the number one thing is, obviously, to get your headache under control, you need to get that muscle tension under control. You need those muscles to be more relaxed. Yes, it's great to find 10 minutes when you get home from work or at the end of your day and go lie down and lay in a dark room and get the pressure off and get that headache to go away. But the bigger question is, why did it come on in the first place? Well, what's happening is, in those muscles in your neck, those muscles, they should be straight fibers, and what's happening is those muscle fibers are getting all knotted up and balled up on each other. They relax, but they still stay in that knotted, balled up state, which is why you get a headache a day later, a week later, or whatever it might be. So what you really need is for a physical therapist to use their manual treatment skills to get into those muscles and realign those muscle fibers. Now you're going to say, I could do that with massage. The answer is yes, you could do that with massage. It will take those muscles from being tight and guarded, and it'll get them to relax, but they'll still be all knotted up on each other. That requires some very specific manual skills that only a physical therapist possesses. Get those muscle fibers to realign with each other, and lo and behold, not only do your headaches go away, but the headache isn't going to come back. The problem that's causing it to keep coming back is now going to be taken care of. Best of all, you prevent yourself from having future neck problems or developing migraines, etc. In addition to that, once those muscle fibers get lengthened out and straightened out the way that they should be, we need to make sure that they stay stretched out. You need to learn some strategies. If you ever start to feel a little bit of a tension there, because it's going to happen, what do you do right away that keeps this from starting all over again with those muscles? And then more importantly, the stronger that a muscle is, and these are muscles that are, again, like the size of your thumb, that are holding your bowling ball head on top of your shoulders, the stronger that muscle is, the better job they're going to be able to do to hold your head up. So that, again, as you're sitting at the computer and gravity takes over the course of the day, and this is where you end up, you can tell yourself, sit up straight. 30 seconds later, you're right back into that same position if those muscles aren't strong enough. So the key to getting your headache under control and keeping it from coming back is get those muscle fibers to be lengthened out. Again, only a therapist trained in manual therapy skills can do that. Get those muscles to be long so that they stop pulling and putting that pressure. And then more importantly, get them to be good and strong so that they hold you upright. You don't have to tell yourself, sit up straight all day long, sit up straight when you're in traffic, etc. And then, even when you get stressed out at work or with the kids or whatever it might be, those muscles are stronger. They don't need to tense up to give you to handle that stress the way that they do. And before you notice, your headaches are going to be gone and you're not going to be having headaches anymore. So if you're having any headache problems, internal or external symptom wise, any headache symptoms, any progression of symptoms, etc., give us a call here at Loudoun Sports Therapy Center. That's what we do. We get the problem under control so that you feel better, but then we make sure that you know what to do long term so that A, it's gone, and B, it's not going to come back and it's not going to cause you any future problems.